Hello, everybody. I'm a practicing therapist and I'm also a doctoral student of psychology. Today, I wanted to go over the specific criteria for social anxiety disorder. A lot of you guys were asking for a little bit more clinical videos, but then at the same time, you guys are also asking for more dating or relationship context videos. So I'm going to try and do both. And today I wanted to specifically talk about social anxiety because a lot of you guys were mentioning in a lot of my other videos that possibly some of these symptoms that you guys are experiencing, you're wondering if it's social anxiety. But before we go into it, I do want to let y'all know this is not like a formal or clinical diagnosis. This is how we do it, but you need to be assessed by an actual provider, okay? And then that will go inside your medical file to which you will be diagnosed. This is not going to be somebody who can just you can look at these points and then say you have it. You can, but it's not going to be a clinical diagnosis. But I made this video for anybody who's interested to know if they have it, regardless of if they want that clinical diagnosis or not. Hopefully that makes sense. The very first criteria for social anxiety disorder is going to be actually a marked fear or anxiety where you can actually feel it or you are aware of it based on your subconscious. If you start evaluating your subconscious, you will see that one or more social situations to which the individual is exposed to possible scrutiny by others. So that might be a mouthful, so let me explain it. It's more that you feel you're subject to some form of ridicule or discomfort to which you feel that's what you feel in those social situations. Those things could happen. So you avoid these types of social situations. Social interactions may include conversations, meeting unfamiliar people. I see that a lot. Being observed is a really common one. I think a lot of you guys brought that up, like eating or drinking or doing something you're afraid someone's watching you. Another one could be like performing in front of others, such as giving a speech or presentation. So that's the first one. Marked fear or anxiety about one or more social interactions or situations to which the individual feels possibly exposed to scrutiny by others, possibly, okay? The next one is fear of acting in a way or showing anxiety symptoms that will be negatively evaluated or perceived by others. And so you're afraid, basically, in a more clear way, I hope, is that you're afraid that your anxiety symptoms will be obvious to others, to which people will judge you. Either they will humiliate you after judging you, they will embarrass you to some extent, they will reject you, or you're afraid that you will offend somebody, okay? The next one is a social situation to which you feel will almost always provoke fear or anxiety. It doesn't mean that you don't go, even though that could be the case, but when you're in a social situation, you might feel anxious or afraid. And some people might even use another vehicle of some sort to establish themselves otherwise, okay? So that could be like using some sort of substance. And I'm not saying for you to do this. This is just an educational video, okay? I'm not saying that, but I know that this is common. People use that. It's hand in hand to some extent in social situations. You've seen that, to which they want to mellow out that anxiety or feel more confident in those situations. Another one would be any sort of fear or anxiety that you feel is out of proportion to the actual threat posed. Now, this is why I mention it's more helpful when a provider is actually evaluating you and able to put this in your file, if that's what you guys want, is because the out of proportion or the intensity needs to be evaluated typically by another person because of that possible threat that you perceive might not necessarily be there the way you perceive it to be. And so an individual who's able to evaluate this disorder will be able to know the different variants to this disorder in comparison to those who don't have it much more easier because they're trained to do so, to which they can tell you if this is part of the criteria that fits for you, okay? The next one is fear, anxiety, or avoidance, to which it's persistent. Typically, we're seeing 6 months or more. So we want to see that these types of symptoms are 6 months or more persistent. Obviously, a lot of these symptoms, maybe you guys know this, it's usually for many years. So we just use 6 months as the marker. That's pretty common in this field, okay? The next one is, again, more easy to evaluate by a provider. We're seeing that fear, anxiety, or avoidance is actually causing clinical distress or impairment, usually in social, occupational, or other areas of functioning, okay? So the next part is we're gonna actually talk about things that we need to rule out in order to diagnose this particular diagnostic impression. And so the first one is we need to make sure that these psychological impairments are not attributed to another aspects, such as substance or another medical condition, right? That's one thing we need to rule out. The next one we need to rule out is what we call a differential diagnosis, which towards the end of this video, I will go ahead and give you some examples of a differential diagnosis. We want to make sure that it is not another diagnosis. And a differential diagnosis just means that these two disorders have a lot of overlapping symptoms. So we need to be more careful about that. So we want to make sure that this is not better explained by another mental health disorder, okay? And we also want to make sure if there is another medical condition that is present, such as Parkinson's, for example, that the anxiety fear is clearly unrelated, right? We want to make sure. Another example could be stuttering, okay? In general, if a person has a stutter, that does not necessarily mean it's anxiety. So we need to rule that out, okay? So that's very important. Another specifier is we need to also pay attention, just as a provider, to just keep a note. Is this performance only, okay? Is the fear restricted only to performance-related anxiety, to which it might be a little bit of a different shift. But let's go ahead and talk about some of the differential diagnosis that we can rule this out. Panic disorder is a really common one. We need to rule out panic disorder. That can be fear of panic itself. It can be not limited to social situations. And it's basically when we have this individual who's having persistent panic attacks, okay? The next one is agoraphobia. This is the fear of being unable to escape or get help in public places. This is usually broader than just social scrutiny or social aspects. A lot of times these individuals are more afraid of maybe somebody being hurt in a social situation, so they're avoiding that. Or this person might have had a lot of trauma in their past when they leave the house or leave other people. And so they have developed this fear based on that. So it's not a fear of somebody judging them necessarily. It's more a fear of what can happen if they are in a public situation. Does that make sense? Then another one we need to rule out is generalized anxiety disorder. The worries are prevalent, and it's not just social evaluation, okay? The next one is avoidant personality disorder. This one is the most common differential diagnosis. This one is what I see as the most overlapping. However, avoidant personality disorder is a very persistent pattern of social avoidance, the feeling of inadequacy, and it overlaps with very severe social anxiety, but isn't ingrained, and it's a little bit more trait-based, to which that individual has become more shaped as a person, personality-wise, based on avoiding social situations. I might have to make a separate video about the comparison between the two, because obviously this was not very clear, and I think it will help a lot of people, because social anxiety disorder and avoidant personality disorder have a lot of overlaps, okay? Another common overlap is major depressive disorder. The social withdrawal is typically due to low energy, guilt, or worthlessness, okay? This is typically with major depressive disorder in comparison to fear of evaluation, okay? Autism spectrum disorder. I made a video on autism if you guys are curious, but autism spectrum disorder is neurological, right? It's not psychological. These social deficits are developmental and broader in scope and are not driven by fear of scrutiny. Another common differential diagnosis is body dysmorphic disorder, okay? Social avoidance is stemmed from perceived deficits in appearance, not general fear of being evaluated in social situations. Schizoid or schizoid, or a lot of people pronounce it differently, this personality disorder, that is usually a lack of desire for social relationships, not fear-based, and it has other criteria as well that is not necessarily due to social interactions. Paranoid personality disorder is another one. This is avoidance based on mistrust or suspicion, not fear of negative evaluation. I hope this video is helpful to somebody. Please like, subscribe. I'll see you in the next one.